really appreciate the opportunity to speak with you all today and also learn from you. Tierney and I were really excited to have this opportunity to speak about patient satisfaction because it's something that is near and dear to both of our hearts, both pre-COVID, pre-telehealth, and then the changes, right, that all of us have had to make since March, and there have been so many of them. Patient satisfaction, I think, being one of kind of the later additions to the telehealth conversation. So we're really glad that CHCA had this topic on the agenda because we really did feel like it was of critical importance to talk through it today. We are going to present a slide deck, but we want this to be somewhat interactive as much as we can. So we're going to pause a couple of times today, bring it back to this screen and ask you to respond to some questions with the reaction button down at the bottom. So if you've never used it before, now is the time to look real quick. And for folks on the phone, I apologize, but it is the bottom, the smiley face with the little plus, and we're going to ask you to respond with the thumbs up when we ask the questions if it applies to you, okay? So I'm going to go ahead and I'm going to drive for today, and Tierney is going to join me on the second half of the PowerPoint today. I think we went over this in some detail already. With some very nice introductions. What we're going to talk about today, one, we're going to give you a very basic overview of CHC. I think Mary Blankston had joined you on a past session, so we don't want to go over our background too much, but we will cover it briefly for folks who weren't able to join when she presented. We're going to talk about telehealth deployment at CHC so you can kind of understand what we've done to date and what we are looking forward to launching in the future. And then we're going to get into the crux of today, right? We're going to talk about patient satisfaction. We're going to divide into two parts. We do a real-time survey for our video patients using our text message vendor. And then we use our pre-COVID survey vendor who uses phone calls to call our patients about any sort of appointment they have, whether it's video, phone, or on-site. And then hopefully we have some time to wrap up with just a little bit of information about clinician satisfaction. Lisa was nice enough to let us include that in today's presentation because we saw it wasn't its own module in your series. So we just wanted to provide a little bit of information about clinician satisfaction as well today. All right, so real quick overview about Community Health Center. This is a really busy slide. We don't expect anyone to memorize anything on here. The basics to keep in mind, we were founded in 1972. Our CEO is our founder. He started it when he was just a freshman in college in Connecticut. We have 16 primary care hubs or physical clinics. And then we have 204 sites in total, and those are mostly school-based. So we are embedded, or pre-COVID, we were embedded in schools around the state. We have 1,000 staff and 150,000 active patients that we care for. We are serving folks for their medical, dental, psychiatry needs, and then we also have specialty services such as podiatry and chiropractic as well. We also have urgent care and our WIA program. Those are for our special populations like our homeless populations. We have shelters that we support. You may also know us through the Weitzman Institute. That's where Tierney resides. You may know us through our Project Echo series or our National Institute of Medical Assistant Advancement, ConfirmEd, or our National Nurse Practitioner Consortium. We have a lot of names. We all are part of the same family though, and that's why Tierney and I are here together today. All right, so enough about us. Now let's talk about everyone's experience, right, since March. This slide that I have, this could probably be for any health center, business, organization since March. This is our actual daily visits to budget from early February to kind of give you a feel pre-COVID down to the drop in mid-March for COVID. So pre-COVID, we were actually doing really well as an organization. We were exceeding our budget targets. We were feeling like we were high on life. And then everything kind of fell apart the first, second, third week of March. So we had experienced a 70% drop in visits at our lowest point, much like many of you, I'm sure. In a very short period of time, about 48 hours after we started hearing that our schools were closing, that was the canary in the coal mine. We started hearing from schools that they were going to be closing, and our school-based clinicians started getting very nervous about their own employment and what they were going to be doing on Monday morning. So a very small team of us outfitted each and every clinician with a virtual Zoom room. So much like our meeting today, they just have HIPAA secure Zoom rooms with the waiting room function as we all experienced today, right? Lisa let us in as the host, and we turned those over in 48 hours. Why did we use Zoom? Because it was already our AV vendor. It had the encryption to meet healthcare standards for privacy and security. And we did not let anyone use anything that was not HIPAA compliant. Even though the federal regs allowed that, right, during this time, they relaxed everything. We said, no matter what, Zoom is gonna be our model. And not only did we use it for video, like we're using today, but we're also using Zoom Phone as well, which is a soft phone app, and anyone can use it on their phone. And it essentially creates much like a business phone in your personal cell phone. So all of our clinicians are also using Zoom Phone. And just to give you a feel for how many patients we've seen since March, right, in the telehealth space. So we've seen 67,000 and change unduplicated patients since mid-March through now mid-July. 87% of our visits at this time are either phone or video. We're starting to open up in-person appointments because Connecticut is one of those states where we've done a pretty good job of hunkering down. So we're starting to open back up for some of those critical population health appointments. I'm sure Tierney is going to mention those. Because we need to see people in person again for some of those true check-ins that there's no way we can do but in person. 81% of our visits right now are being done by phone, and that's because Connecticut allows us to be paid for phone. Thankfully, that legislative change was made in March, and we have 19% of our patients doing their appointments on video. And you can see the breakdown in behavioral health and medical down below. So our medical folks really started with phone, our behavioral health folks started with video. So that's why you see so many more video appointments being made on the behavioral health side than on the medical side. So just to give you kind of a feel for some of the meteor projects that we've done, on our initial and established patient side, so whether they're brand new to the agency or we're seeing them for recurring visits, we're offering phone and video appointments for medical and behavioral health patients. We are using video for our behavioral health groups. So just like we're seeing each other today, we're doing groups the same way as this on Zoom video. Our telemedication assisted treatment for folks that need Suboxone or other assistance with behavioral health, that must be done by video. That's a Connecticut state requirement. And then our Teleparents as Teachers program. So we used to have our Center for Special Populations go out and visit new moms and folks who may need assistance with social work out in their homes. Well, obviously we're not able to do home visits anymore, so they're doing video drop-ins with families. We have two really cool projects that are well underway and are in development right now. The first of which Tierney is leading, and that's our Medicare tele-annual wellness visits. We're getting ready to launch 2 teams who are going to be piloting this. It must be done by video. Again, this is a requirement of Medicare that we have the patient on the video the entire time. And then the other thing we're starting to tinker with is reopening of schools. And when we have talked with some of our schools, they've said, you know, we may have the students come back, but you know that room we used to give you off by yourself where you could run it and the patients came down whenever they needed a medical or behavioral health service? Well, we're taking that back now because we need those for isolation rooms, or, you know, we need those for social distancing purposes. So we have a feeling that many of those rooms we're going to have to give up. But instead of taking the service away, we're likely going to leave a video cart there. So the student will come in, they'll sit down, the Zoom screen will already be up, and the clinician will already be there, probably from home, and they'll be able to have the same visit that they would have pre-COVID, is what we're thinking. So we're getting ready to deploy a whole bunch of fleet of kind of iPad on a stick, I've been calling it, iPad Pros, to our schools to be able to continue with their care through the fall and beyond. And then we have 2 use cases that are unfortunately on hold due to the nature of the programs. And those are teleoral health in the schools. So we got a grant to do asynchronous images with a intraoral camera that would actually go back to the dentist and they'd be able to see where there was decay. It would light up in different colors, very cool. Got put on hold in the fall. And then teledental, which Connecticut has approved, but we don't have the codes yet. So we're still waiting for the state to come back with the codes for those teledental video appointments. One thing I also want to mention, like many of you, our patient communication changed quite a bit when COVID hit. We had used text messages for reminders about people's in-person appointments, but for the first time, we really had to rely on our text message vendor to contact people and say, hey, we're no longer open, right? We're closing our clinics. We're moving all of our appointments to phone or video. You know, you may get a telephone call from a blocked number or from a number you're not familiar with. Maybe it's Zoom phone, but please answer the phone. So I put up kind of 2 examples of text messages that we had to start sending to patients really quickly to let them know of all these changes in our structure. So for telephone appointments, patients were informed not to come to the office and to expect a call at their appointment time. And then for video appointments, what was even more critical is we were actually embedding the Zoom link to join the patient, or join the provider, I'm sorry, in the text message. So it actually says in here, and we gave you an example, you know, to download the Zoom app, click here, and it would actually take them straight to whichever store, right, that was on their phone, and they could download the Zoom app. And then when it was time to join, they also had the link to actually click right away. There's nothing they have to enter. It takes them right to the waiting room for that provider, and then the provider admits them into the room. So that was something that we also stood up with our text message vendor at the same time we were deploying Zoom video. And I also wanted to take you through some of the teams that we set up to support this whole thing, because I'm sure many of you had to do something similar, right? When we roll something out in 48 hours, as hard as we train on the logistics and the workflow and the documentation, there's just no way you can cover everything in that short a period of time. And you really need to have teams of people available to assist. So there were 2 teams that we created just for the clinicians on this. One was on the tech side, and this is our patient or our provider support. We named this CHC Telehealth Provider Support. These are typically IT desktop folks, help desk folks, and they're helping our clinicians set up their Zoom room for the first time, troubleshooting those audio and video issues they may be having, resetting passwords, you know, things that could really kind of make or break your appointment. And we were typically responding to folks within 30 minutes. A lot of times it's real time using kind of our Skype function, right, our chat function. The second team we set up was something I like to call the concierge team. So there are a lot of questions when it comes to telehealth outside of the tech. You know, people have questions about how to complete their modifiers, right, on their billing codes. What happens if they leave the state or their patient leaves the state, right? In this kind of weird world, every state has their own legislation about how they're going to handle the COVID emergency. Maybe they had questions about their scheduling templates, or they just wanted to provide feedback on how it was going. This team was really created to assist with any of those non-technical questions that come up every day for our providers. And the typical response time was anywhere from 2 hours to 1 day, depending on if we have to reach out to finance or one of our legal experts to get back to the patient and the provider on their question. And I'm realizing now I skipped one of the poll questions. My apologies. I'm sure Lisa and Tierney were like, you missed one of the questions. We'll come back to it. The third team we set up was on the patient side. So much like our clinicians, our patients for the first time were, you know, having all sorts of things they had to do that were part of their responsibilities for the visit. They needed assistance, a lot of them, because we have, you know, folks who may have never gone to an app store before. So we created a team that anytime a patient had a new video appointment, they were instantly transferred from the call center over to this team. It was a warm handoff for every single patient, and we're still doing it now. So they're helping them download the Zoom app in real time. They're testing the Zoom app with them. They're actually showing them how to join it, so taking them through the whole way using kind of a test account. And then if there are issues during the appointment, the provider can actually link this team and say, hey, the patient is having problems with his or her audio video. And then after the appointment, they follow up and check it all out and make sure that it's fixed before the next session. And they're also assisting with group sessions, because when you have 7 or 8 or 10 people on a session, you really want it to go well. So they were kind of serving as the moderator as well during these sessions to get them going. And then the final thing we did, and this isn't as much of a component now as it was in March, but I still wanted to highlight this, is when March, when kind of the pandemic was really at its worst and the fear level was extremely high with our patients, nobody was calling CHC. Everyone was at home. No one wanted to schedule an in-person appointment. And so we had extra support resources on our call center and our patient service associate areas. And so what we did is we redeployed them because we knew that our clinicians were going to need them. And we designated them the TOT team, the telephone outreach team. And every clinician was assigned a TOT person to assist, to contact patients if the clinician was running late, to confirm if a new patient is coming to their appointment. They can switch them between video and phone, they can reschedule, or they could reach out to group patients. And we found that this was really important in the early days because there was kind of so much chaos with whether patients were understanding this model. This was kind of getting us to the last little step before the visit to make sure that the clinician and patient were on the same page. So we didn't lose those visits in the early stages. Our model is much more established now, and our TOT resources really haven't been needed as much. They've kind of gone back to their regular job, but this was really key in the early phases. Last thing I wanted to mention here was just some nice press coverage we've had. We had a USA Today story featuring our teen art therapy group. So they actually were drawing together, and this was one of our school-based programs, which was really neat. We've had several local interviews that have been highlighted in the news media. And then our Weitzman Institute is doing a school-based Health Alliance national webinar on the work that we've done with our school-based practitioners. All right, so now I'm sure you all want to know kind of how we're assessing all of these things that we put into place. So the first thing that we did is we created a 5-question survey in SurveyMonkey. It was nothing complicated. And this survey goes out via text message after video appointments. And we really felt like this was the canary in the coal mine. If patients were having any difficulties at all, we wanted to know about them right away. I didn't want to have to wait for a quarter or a month's worth of data to hear that the patients were having audio issues, or maybe they didn't like Zoom. They didn't like the audio or video that they were experiencing. So these were the quick questions that we put together based on some research we did that we thought, one, the patient would let us know about, wasn't too long, and two, we really wanted to know about so that we could follow up with all those teams in real time. So I'm going to take you through all of our data to date. So we started measuring this at the very first appointment. We actually had no appointments that went out without this survey. So as soon as the person got done with their video, we send them a text that says, how's it going? How did it go with your provider? And then they click on the SurveyMonkey link and it takes them straight to that. So these are the same questions that were on the previous slide. I've just blown them up and filled in the data here. So again, this is from mid-March up through late last week. I just pulled the data, so this is up to date. And we asked patients whether the telehealth visit picture and audio quality was good. That's that first column. We asked them whether they received the same quality of care during a telehealth visit as an office visit. The third column, whether they were satisfied with the telehealth and scheduling instructions from the clinician or the office, meaning any of our administrative staff. And then number 4, whether they were interested in using telehealth for future appointments. And this has been consistent since the beginning. We've had 4s, 4.5s out of 5s all the way across on our data since the beginning. And of note to me, and probably the most important thing to me, is that 84% of the patients are saying they're interested in using telehealth for future appointments. And this is a very large N at this point. 551 of our patients have answered this. The other thing we wanted to know, especially because we are dealing with Medicaid patients who may have had to travel using public transportation, they may have had to get rides from folks or take time off of work, maybe they have childcare issues, is how much time are we saving them by now instituting telehealth? And we thought this was important also for some of our state agencies to know about, right? So we asked them, how much time are we saving you? And we gave them buckets of time to choose from. And our CEO, kind of laughs at this data because he says, our patients most likely were waiting at least 20 minutes, 15 to 20 minutes just when they got in the building. So we actually think these are probably skewed on the low side. I think our patients are being nice to us, saying that we were only maybe 10 to 30 minutes in wait time and total travel time. He actually thinks it's probably closer to an hour on average between time off of work, travel, and wait time. But this has been really interesting to see these numbers from our patients. And then the other thing that we provide is just an open comment section. And this is my favorite part of the survey because this is written straight from our patients. So they use emojis, they tell us the good, the bad, and the ugly on here. And what we see is that by and large, we have very positive feedback. You know, we have people say, I don't know why you guys weren't doing this before COVID. And we're kind of like, we don't know either. State wouldn't have it. You know, for people that have behavioral health concerns, right, they wouldn't have left their house. We hear that over and over again. They're like, this is fantastic. I come to my visit now because I never have to leave. I don't have to take time off of work because I have multiple kids and I'm only, you know, needing a visit for one kid. On the other side, though, I think our patients are getting, some of them, more tech savvy. So we kind of have two ends of the spectrum. We have the last comment on this slide that the patient is essentially telling us they've used 4 different telehealth platforms at this time and they don't like Zoom. That's, you know, that is candid feedback. And then we're also hearing from some of our other patients, they're just not comfortable with video yet. You know, it's not their jam. You know, if they are older, they're telling us they're older. I'm not saying it. I think it doesn't matter your age, but for some of our folks, they feel like because of their age, they're not able to do this. So we really take a hard look at this. I look at this data probably twice a week and send it out to our teams if there's any kind of canary in the coal mine on this. All right. So we have a couple of survey questions, poll questions, before I turn it over to Tierney real quick. I'm going to stop the share. One of them that we wanted to know about from earlier in our slides is for you all. Are you surveying your patients with telehealth visits now? Is there any sort of survey you're doing? And if you are, if you could hit the reaction button and just give us the thumbs up. We're just curious to kind of take a straw poll. I'm going to take that as maybe nobody, or if you're trying to talk, I know everyone's muted. So, and the other question I wanted to hear about is for folks who are using telehealth appointments now, video and phone, approximately what percentage of those visits are performed by telehealth? And so I'm just going to read off some groups, and if you could use the thumbs up when I get to your group. Less than 25% of your visits? Okay, good. 25 to 49, okay, 50 to 74, and 75 to 100. Okay, so good. Thanks for participating in that. So I'm going to kick the presentation over to Tierney now, and she's going to take you through the other side of our patient satisfaction, and that's really through our third-party vendor that we've used for some time. Tierney?
Thank you, Meredith. If you want to go ahead and pull up those slides, it's a pleasure to be with you all today. So I want to talk to you about what existed before COVID and then how we modified that to give you a sense of what's changed and what's stayed the same. So prior to COVID, we had used and now continue to use an independent survey vendor. This vendor is one that is experienced in designing, deploying surveys for FQHCs. So they provide us with benchmarks that we can compare ourselves to a practice that is similar to CHC. So that's been very helpful. We have years of experience working with them. And their process is that they survey our patients 1 to 2 weeks after the patient completes an appointment. So we send them a list of patients who had an appointment, and then they contact those patients and meet different criteria. We want to have a sufficient number of a sample size, if you will, for each of our sites and providers, et cetera. So they try up to 8 times, call those patients, and have a great deal of success in meeting our needs there. Once they have those survey data processed, they report to us on a quarterly basis. So we get a full set of very comprehensive reports about the satisfaction of our patients with their medical visits, behavioral health, dental, and those data are reported by discipline, by the type of visit, et cetera. So really robust set of reports that we have. And in addition, on a weekly basis, they're telling us about any patient who had an experience that was not optimal, and that have agreed for us to contact them and do some service recovery type work, if there are any that week. So that's all pre-COVID. Once we were in March and we saw that, as Meredith said, within 48 hours, pivoting to telehealth, recognized that there was really a need to understand what's the experience of our patients. Some of those questions are no longer relevant, right? If patients are staying at home and having telephone visits, the cleanliness of our facilities is no longer applicable. So we really had to think through a change in the skip pattern was one option, or we could have completely modified the survey and have a whole different set of questions. Because we want to be able to benchmark ourselves against prior performance, we decided to keep as many of the questions as still make sense logically for the experiences of our patients as we could. And then, so we have those skip patterns. If you're a telehealth patient, we're not going to ask you cleanliness. But in addition, we needed to know a few other things. For example, the questions that Meredith mentioned: how much time do you feel is saved? And will you want to continue visits by telehealth? So we really spent some time thinking through the development and modification of our existing instrument to be able to benchmark, but also collect additional data. So how did we do? What did we find after our first quarter of complete data where we had pivoted to telehealth? What this slide is showing you, the pink line are our patients who had telehealth visits via video. And there were about 108 patients in this survey sample that responded. And by and large, their experience was the most positive when you compare it to patients with telephone visits and patients with in-person visits. So there were about 185 patients who had an in-person visit in this sample. 108 responded via video, and 709 responded because they had a phone visit. And so as you follow this pink line, you see overall satisfaction, highest among patients with the video visit. Phone attendant friendliness and professionalism, appointment wait, et cetera, et cetera. By and large, those were the most satisfied. You get down to something like interpreter satisfaction, and you find, though, that there was something that needed to change. That experience was less than we might want it to be or expect it to be based on all of the other data. And so we dug into that and have addressed a concern in the workflow that now is hopefully we're going to see reflected much higher numbers now that our providers and medical assistants are clear about that process. So really helpful to be able to look at our data in this way. As I mentioned in that first slide that I presented to you about our modifications to the survey, we really wanted to be able to benchmark ourselves against prior performance and understand how the experience had changed given the pivot to telehealth. So the first, the second, third, fourth, and fifth columns are the 4 quarters that preceded our pivot to telehealth. The third to last column is just an aggregate or an averaging of all of those first 4 data columns. And what we've done is compare those 4 quarters to the second quarter of 2020 to try and understand what is the difference, how has the experience changed. And so that last column is the one I want to draw your attention to. The green coding indicates there's a statistically significant increase over in the second quarter compared to the prior 4 quarters in our performance on a given item. And the red is a significant decrease. So you can see that while overall satisfaction and new patient registration dipped down a small bit, those are not statistically significant. So they're virtually unchanged, if you will. But if we get down to a question like ease of reaching a live person by phone and these other questions in green, you can see that we had there's a change in the experience. We've done something that systematically has changed the experience for patients. So very helpful to understand that and to be able to look at that and be proud of the great work that our teams are doing each and every day, and to give this data to them because this is what they're delivering. We do see that the ability to see your own PCP had a drop. It's very small, but statistically significant. Likely the result of quite a number of factors in this environment. For example, we have, as Meredith said, limited on-site teams during this time. So we want to make sure our youngest children are receiving their immunizations. So perhaps the on-site provider that day or nurse that day was not the child's pediatrician and nurse that they typically see. But because of the way we've established ourselves, we do have a rotating set of staff who are on-site and committed to being on-site. And it might not be the child's provider that they typically see, but they might have they probably talked to their provider before that in-person visit, for example. So something to watch, but not a huge change, but something to keep an eye on. So we're pretty excited about these results, and we'll continue to watch them as they come in over the next few quarters. We also wanted to understand the difference between phone and video. What was the experience like? Take the in-person visits out of the equation and compare, for example, these two concepts: overall quality of care by provider and ease of connecting with the care team. And you can see here again, patients who had a video visit had a little bit higher satisfaction rate than those via phone, which is good because we're not certain that phone is the way that we're going to be able to continue to deliver care as situations and regulations continue to change. The next slide tells us about the experience of our patients connecting with their care team within 15 minutes of appointment time. It's hard to know. We're not in the office and all seeing that, wow, there's a big backlog in the waiting room and patients aren't getting seen. It's hard to know if we're not there. What is the experience of our patients who are having these visits on phone and video? And we're delighted to see that it's even higher than for patients in person. 99% on video thought that they connected within 15 minutes of their appointment time. Important to track and make sure we continue to have these rates. And you see here the amount of time saved by telehealth. This is very much akin to what Meredith showed you. And I absolutely agree that any patient that says less than 10 minutes, I didn't know they lived at the health center because it takes that long to cross the street in some of our centers. So what you can see here, and one of the things I take away from this graph, is that more than half of our patients, about 55%, saved 31 minutes to up to 3 hours. A huge time savings that in many cases is dollars in our patient's pocket by not having to pay for childcare, not having to pay for the bus or a friend's time to drive them, et cetera, et cetera. So good to see this, and we'll continue to track it. We wanted to look, was there a variation in those responses on the prior graph by whether or not the patient had a behavioral health visit or a medical visit, by whether it was a telephone or a video visit? And what I take away from this is if you look at the 1 to 2 hour and 2 to 3 hour groups, you see that behavioral health video and behavioral health phone had much higher responses than medical video and medical phone. So perhaps there's something about our patients and they're accessing behavioral health services via telehealth that is saving them more time, something different about that population to understand and just be cognizant of. So interesting to always disaggregate the data to the most fine level we can. to understand what our patients are really experiencing. Another piece we looked at is future telehealth preference to understand, are patients going to, would they prefer to talk to providers at night after working business hours, if you will, or really early in the day? And this graph is a little bit surprising. I might have expected people to be more spread out here, but the large bulk of our patients are satisfied mornings or afternoons in the future to have those visits. A few certainly want to have these visits in the evenings, but the large majority. And knowing this helps us predict or not predict, I wish I could predict, but plan for the future. And so helpful to see this. So then what we did on the next slide was break this down. Is there variation again by behavioral health, medical, video, phone? And we don't see a great deal of difference here. Not something that would cause us to make any distinct changes in our approach by the type of visit. And likewise, when our patients are talking with the independent survey vendor, they're given multiple opportunities to provide comments, which are logged, and very similar feedback. So it's great when your data really are concordant, regardless of the methods of collecting that data. I find it really interesting, patients who have multiple children that need to be seen, to be able to do all of that at one sitting, you know, bring the first one in, the next one. I think that's wonderful to hear. So we also had great comments here. And then of course we had patients who are savvy. Doximi is another platform patients can use and have used and find that to be helpful. We have patients who are have said that unless you put a stethoscope on my chest, I didn't really have a visit. And of course, we respect the full gamut of experiences and want to make them optimal for all of our patients. So these are reviewed and really taken to heart as we tinker with the ongoing iterative improvement in all of our systems. I think I skipped a poll question as well, Meredith. So perhaps I'll just stop here and ask you all, thank you. For those FQHCs who are surveying patients, and I'm not sure anyone responded that they were, but if we missed that, have you seen any of that variation in satisfaction among your patients based on whether or not they're via video or in person? So yes, you've seen variation if you would do the thumbs up reaction. Okay, no variation. I think it's because you indicated you haven't modified those the satisfaction surveys, but we can all have an open discussion once we're all together. Thank you, Meredith.
No problem. And with the last just kind of couple minutes, I'm gonna go back here real quick. And if I'm getting choppy, let me know. Am I still okay? Okay, good. I was getting some weird feedback in my headset. The other thing, since we have just a few minutes to take you through, we also wanted to give just a little bit of a snapshot at what we're doing to assess our clinician satisfaction with telehealth during this time. So as we mentioned, you know, there are two really important pieces of data that we are on top of all the time: the patient satisfaction, right, and those patient support teams that we created, but also our clinicians. Because if our clinicians aren't happy with the tools, they're not going to promote it to patients. And the second that we start opening up, they're going to say, I want the heck off of this virtual platform, right? So we really listen very closely and keep a pulse on our clinicians, on the real-time feedback they're giving us, anything they're sending to us. But we said we don't have a good sense overall at the agency level with regard to how everybody's doing. You know, there may be some folks that are really unhappy and they just don't want to voice it. So just recently, we deployed a telehealth clinician satisfaction survey as part of our general CHC staff survey this year. So we carved out kind of the second half, and if people reported that they're either a medical or behavioral health provider, we gave them some more questions to answer on the back end of the survey. So these focused on whether they like Zoom, their ability to connect with patients. So these mirror kind of what we asked the patients, whether telehealth care is equivalent to in-person in their mind, and then their interest in continuing to provide care via telehealth too, not just the patient's interest in continuing to receive care. And so these slides were really interesting, and my team, really dug into these. The first question was whether the Zoom video, audio and picture quality is good. So just like we're experiencing today, whether this experience was good for the providers. And what they're telling us in general is that overall they agree that the audio and picture quality, is sufficient for these visits. This is very much kind of a bell-shaped curve, right, where we have people on either end of the spectrum who are saying, yeah, it's great, I really like it. And then we have people saying, I'm either neutral or I strongly disagree because maybe I'm using Doximi in my private practice. Maybe I'm using Mend, or I've heard about other platforms. So we weren't surprised that we're going to hear some feedback like that from the clinicians too. There are always a variety of options and opinions when it comes to whichever platform you deploy. The second question we asked is whether our platform, Zoom, for video and phone, because they are using both, whether that makes it easier, nothing's easy right now, but makes it easy to connect with patients for telehealth visits. And again, we actually see, some agreement in the data on the strongly agree, but we see a little bit more movement in other aspects of these specific modalities, right? So for video, we're seeing that about 50% of people are agreeing that the Zoom video platform makes it easy. We only see 44% of our phone folks reporting that, and most importantly, we see 75% of them saying they actually disagree, that Zoom phone is making it hard to connect with patients. Now, we know in the background what's happening with the phone calls is a lot of times the provider is calling the patient at their time. Let's say it's 2 o'clock, and maybe that patient is out mowing the lawn. Maybe they are driving, maybe they're picking up their child, and they don't answer the phone. And what happens then is that the patient is calling back into our main number, because we don't give out provider direct numbers, and now they're playing phone tag. Unlike the video, right, where you sit in a waiting room. So even if the provider is not on time, you're there at your time. We have a little message saying they're going to be with you shortly. Check your AV ahead of time, and then they admit you. So we weren't surprised about this. The phone calls, although we have a lot of people doing them, and they still report very high satisfaction, the ability to connect because of this phone tag thing we knew was going to be an issue with our providers. The third question, which I know our medical leadership actually considers this the most important question, both on the patient side and on the provider side, is considering the circumstances we're all in, do your patients receive the same quality of care now as they did pre-COVID, right, with an office visit? So, again, 90% of our visits, give or take, are via telehealth right now. And this is almost a perfect bell-shaped curve if we look at this. So we have people on the positive side, the negative side, the neutral side saying, I think I'm able to deliver just as good of care. We've heard a lot of that from behavioral health, right? They're saying we don't need to see the patient in person ever again. A lot of them are saying that. And the patients are saying, I have no reason to come in when I can speak with you here. My guess is on the medical side, if we delved into this a little deeper, we would probably see that the medical folks who are primarily doing phone are saying there's no way this is equivalent to what I was doing before. I either need to see them in person or I need to see them on video. And we're really starting now to push video for medical providers so that they are getting eyes on the patients, because we know this is going to last longer than just these few months. That's one of our focus areas right now, is really rolling out video for medical providers as well. And then this is the last slide that we wanted to show you. So we did ask them, what percentage of all visits would you want to be telehealth in the future? And we say post-COVID, which now I kind of laugh about that because who knows what this is. But in the future, what percentage of all visits would you prefer to be phone or video? And by and large, our patients, 70% or our providers, 70% of them are saying, I'm fine with half of my visits being phone or video moving forward. And this really blew me away, because we did absolutely zero telehealth appointments before March, because it wasn't allowed in Connecticut. We did not get paid a dime for telehealth, video or phone. So the fact that we rolled this out in 48 hours and now we're 4 months into it, I was really astonished. I thought this would be higher, where people said, you know, I really don't want to do this anymore. I don't want to do half my visits. I want to come back in person. And remarkably, you know, on the high side, we have, you know, a good chunk of people saying, I'm ready to go all remote at this point. I really do not need to step foot in an office ever again, which was really remarkable. And the last thing we wanted to show you is that, and this slide is now a couple days old, so we've already deployed the survey. Our whole agency deployed a return to work survey, both for us as administrative staff and also the clinicians. And all of us had to choose where we want to work, physically work out of, through June of next year, through June of 2020. So Tierney and I already got our survey and we responded to it, or 2021, thank you. And the clinicians had these choices to choose from: 100% remote, 100% on-site, meaning going back to exactly where they were before, or a hybrid of on-site and remote, meaning at their house or in their pod, in their physical pod where they always saw patients. And then the fourth was a brand new option. So we built 2 telepod locations. One in Middletown, Connecticut, and one in Stamford, Connecticut. So they're about 45 minutes away from each other. And I showed some kind of screenshots of these architectural layouts, but these are the desks that folks would work at if they do all remote visits. So we have a standing desk that goes up and down. We have 2 screens. We have a light that goes over top to kind of illuminate their face. We have acoustical panels behind the space that absorb noise and also make a nice flat background. And we only have nine stations in this picture we're showing you. So it allows for social distancing, and it also has special ventilation. They will be wearing masks when they're in these spaces, but we're looking for the transparent ones, so that especially for our behavioral health patients, you're not seeing a provider with a scary mask. They can actually still read their lips, you know, see all their facial expressions and all of that. And our supplies team is looking into ordering those. So we're just beginning to do some trials in these spaces. And then we expect to have these fully staffed here in the next month or so. All right, so we were able to cover everything. We have 2 minutes left. Lisa, I'm gonna kick it back over to you.
All right, thank you very much. So I am gonna get in here. Now I'm going to unmute. I'm going to allow everybody to unmute themselves if they would like to actually ask some questions in person, virtually here. Of course, you can always go ahead and put your questions in the chat, and we'll get those answered for you. So everybody, I have allowed you to unmute yourself if you would like to.
So the question is, can we explain more about the teledentistry? Sure. So in the state of Connecticut, they allowed for us to use a couple of different codes for real time. It's not asynchronous, it's real time teledentistry. And what we have decided we are going to use the codes for is a 2-way video appointment to really talk about that person's clinical condition, and to use it as a triage visit to determine, do they need to come into our sites for emergency care, which we can still do in the state right now. They can see their dentist for any emergencies, or can that tooth or that condition wait until we're back with full preventive care, you know, hopefully in the fall, but we'll see. So they're really not, you know, sticking an iPhone next to their tooth or anything like that. I had some people ask about that. I mean, I've heard of it. It's very hard to do. I actually tried with one of our IT people, but that's what they're using it for, is more like a real-time video triage visit.
All right. Any other questions? You can unmute yourself and ask if you'd like. I tell you what, I do have a question that I'd like to ask. I was just curious, you know, what do you believe, or what, in terms of y'all's experience in rolling out telehealth, has been the biggest challenge to overcome around patient satisfaction in this new world of telehealth?
I think for me, I'll just speak on kind of the text messaging side. I think what we've figured out is that everybody right now is using the same kind of forms of communication. So I know I've gotten text messages from my dentist, from my hairdresser, from my bank, from the airlines. Like all of a sudden, everybody is scrambling, right, to maintain their customer or their patient bases. And so I'm finding that it's harder for us to kind of break through some of that noise and say, hey, can you tell us about our appointments too? And especially when our Zoom link comes through in text message and our survey can come through text message, I think people are getting a little overloaded. And I've heard the same thing on phone, right? Because we don't have any in-person anything anymore. People are calling and using text more, where before that wasn't as common. So I think the overload of text and email and phone is somewhat of a challenge and potentially a barrier. And I think the longer this goes on, the more people are going to get weary about it.
Yeah, I would just add to that. I think, you know, the digital divide is a real issue. So we don't know what we don't know for our patients who are unable to use their minutes for a phone visit or have internet. I see the question, internet access issues. That's a little bit of a big challenge for a small group of our patients. And we do have partners out there who are willing to help us, but I think it's the ones you don't know what you don't know. And that's what, you know, the blind spots that perhaps we need to find other partners and make sure that we're covered for those groups of patients.
Are there any other questions for our guest speakers today? Folks are a little quiet today, I think. I'll give you just another minute or so if you have any questions. Please feel free to chat or put it in the written chat.
Thank you for the great presentation today. Another question that I actually have is pertaining to schools and the anxiety that many parents or teachers are actually facing. What policy procedures are you actually looking at within your school-based health clinics as it pertains to COVID-19 and just students if they test positive? Or are you even doing a deeper dive and thinking about that?
So there are a couple of things that we've already started to work through, and I'll start with this and I'll get back to, you know, the bulk of your questions. One of the things is that, you know, all of our kids, regardless of whether they're full-time home or full-time at school or some hybrid, are still going to need immunizations. And we used to give these in the schools, but that's no longer possible. So the first thing we've done is now start to think about providing these at our fixed sites, right? Our 16 fixed sites. The second piece is that we sent out a separate survey to our school-based providers asking about their school. So it was much more in-depth than what we showed today because we asked them, are you going to have room to do social distancing? Are they going to let you in your same space? Can you wipe down everything in the space? Some of them had rugs and pillows and, you know, things you really can't disinfect. And so they're going out to the schools right now and gathering all that stuff up and they're taking it home before the kids get there. And then we also asked them, how many of you are not planning to return to the school, even if the school reopens, right? We have folks that have chronic conditions who are older, and they got to give us their preference in that survey. And so we're actually going through school by school right now. It's a big lift and saying, okay, for you know, Middletown Elementary School, is the provider going to come back? Yes or no? If they are, can they social distance? Yes or no? When are they going to be there? Certain days or not? And then can we outfit that space with one of those iPads on a stick? So we actually have 2 fellows who are with us for the summer and some of our school-based staff who are going through all those responses and making a plan for each and every school. And then we have to abide by, of course, school administrative guidelines regarding how they're going to handle those off days and, you know, testing of patients and all of that, and if the school gets locked down. But we want to be as proactive as we can before they make that decision.
Thank you for sharing. Any last questions before we close? All right, well, I just want to thank our wonderful speakers today for joining us and sharing their expertise. And it's been interesting really hearing, you know, what you all have gone through and how you all have been able to take that and move so quickly. I mean, after hearing Mary at the last session, you know, she talked about how, you know, you weren't doing any, like you mentioned today too, but then you had to really jump into it. But now y'all are really going back and assessing how it worked, what you need to do differently, all of those things. But it's great that you've been able to, on the onset, be able to start surveying your patients and really knowing what's working and what you need to change, and being able to address that quickly, because I think that is important to patient satisfaction. So thank you for sharing. I want to thank everybody else for being on today. We are going to send out an evaluation email that you'll receive. Please fill that out. We really want your feedback. And then also be sure and register for the others. I also want to ask if any of you joined by phone today, if you could please type your name in the chat. That way we can trace that phone number back to you. Otherwise, we don't know who to send the evaluation and the slideshow and the recording to. So again, please, if you're in by phone, please put your name in chat. That way we know you were here. So anyway, we appreciate it. Please let your colleagues know about joining the others. Next week, we actually have Dr. Anderson that will be speaking, and he is also with Community Health Center, Inc. And he will be sharing some great information around serving and working with vulnerable populations. So we're excited about that session as well. So we will see you back next week, everyone. And again, thanks to our speakers. We appreciate you.
Thank you very much. Great to be with you.
Thank you, Lisa.
Thank you.
Bye-bye.
Bye-bye.